My name's Claire Kelly. I'm the Manager of Youth Programs at Mental Health First Aid Australia. So the signs of non-suicidal self-injury, some of them honestly are pretty obvious, literally seeing injuries. And sometimes it can be just, the sleeve is pulled up just a little bit. As soon as somebody's noticed, the sleeve comes back down again. And it's a way of saying, this is how bad things are. So we might see injuries, and particularly injuries that appear to happen in the same place over and over. And that might be things like cutting and scratching, which are the most common forms of self-injury. But they can also be bruises from either hitting a body part against the wall, maybe punching a wall, something like that, or hitting yourself. So we see more hitting type injuries with boys and more cutting and scratching type injuries with girls, but it's not clear cut by any means. We see both sets of behaviours in both males and females. So for a parent, you might see things like blood on the inside of sleeves of clothing, blood on bedding. You might notice that a lot of first aid supplies are going missing, although it also might be something like the first aid supplies aren't being touched, but the young person's actually spending a significant amount of their own money on their own first aid supplies. And that can be a way of sort of self-soothing, apologising to the body for the harm that's been done, that sort of thing. We might see sensitivities around parts of the body that are injured. So a young person might, respond as if in pain when bumped. Probably one of the most common things we see is wearing long sleeves and long pants, where that has not been common, particularly in really hot weather. But also got to remember that some young people will injure themselves in places that you just would never see, on their stomach, places that are always covered up. Or virtually always covered up. A young person might not want to go swimming anymore, that sort of thing. I think the most important thing is that if you've got suspicions, and look, self-injury doesn't happen in a vacuum. A pattern of self-injury occurs because a young person is experiencing high levels of distress, doesn't have good coping strategies, and comes to find, whoa, this thing actually really works. And once something works and works well, there's no great motivation to find something better. So if you've got suspicions, address them. Ask the question, and ask it in a way that makes it, that's not, oh, you're not cutting yourself, are you? Because that's very clearly indicating that you want the answer to that to be no. Saying, hey, I'm a bit concerned. I've noticed, you seem really unhappy. And along with some other things I've noticed, I have to ask you, have you been injuring yourself? And make it clear that they're not in trouble.